In skincare, when we apply things like retinol, we help increase our cell production rate, and this helps new cells rise to the surface much faster. So we're helping our skin behave in the same way it did when we were younger, and it can help them with lines, wrinkles, texture, acne scarring, and pigmentation.
So everything really.
Pretty much everything.
Yeah, I always say to my patients, it is the holy grail of skincare. If you're not on a retinol, you really want to be getting on one, and don't leave it too late either. It's never too late, but it's always worth getting on one in your 30s and 40s if you can, because your skin will look much younger as time goes on. So tell us about the Skinceuticals retinols.
Well, with Skinceuticals retinol, we have 3 strengths available. And I always recommend starting with the lowest strength that you can do, because this will help your skin with the adjustment period. Retinol can be quite harsh, so always go low and go slow. The retinol 0.3 is ideal for anyone who's new to retinol. You've got 0.3% retinol inside here, and that is a pure percentage, so it's quite potent. It's encapsulated for slow release, and this helps us to not get too much irritation as that retinol is absorbed by the skin cells. And then to help support the sensitivity that retinol can sometimes cause, there's chamomile and frankincense that are going to soothe the new skin as it rises to the surface.
And I love that about it, the chamomile and the frankincense, because retinol can feel a little bit harsh, especially if you first start using it. And I love the fact it's got these soothing elements to it, definitely.
So it's always nice to make sure that we're not too aggressive with the skin. Retinol can be very aggressive for people, so we want to try and make sure that that new skin is not going to come through, bright red, inflamed and sore. We still want to feel like ourselves at the end of the day.
Yeah, absolutely, absolutely. So how do you use retinol, and in particular the Skinceuticals retinol, Charlotte?
There's lots of different ways you can incorporate retinol into your skincare routine. As I say, we go low, we go slow. So start with the lowest percentage. We'd recommend our 0.3% and introduce it slowly into your routine. So maybe just 2 or 3 days a week. It's a nighttime use product, and that's very important because retinol itself is destroyed by sunlight. So if you were to use it in the day, you're just wasting your product. Always make sure it's at night. And to get the most benefit out of the product, it should be the only thing you apply that evening. Cleanse, tone, and then apply your retinol.
Oh, that's really good advice, actually. And are there any side effects to using retinol at all?
There is always an adjustment period. So thinking of the way that retinol works, it's helping with cell production. And the quicker those cells are produced, the quicker they're going to rise to the surface. And they can rise up feeling a little bit unprepared to be at the outside, a bit dry, a bit sensitive, and we have that shedding of the old cells coming away. So for some people, they can get some dryness, some sensitivity, and some peeling when using retinols.
And is there anything we can do to counteract that at all?
I think it's important to note it's a temporary effect. It's only while the skin is adjusting to retinol. So if you can push through it, keep going. If you are struggling with it, or if you simply don't want to have those side effects, then we can use something like our Triple Lipid Restore 242, which has been proven to work really well alongside vitamin A based products to restore the skin barrier and avoid those uncomfortable, irritated side effects.
Yeah, that's really good advice, because Triple Lipid Restore is a very comforting product, isn't it?
So I think of it as a comfort blanket. Whenever the skin is in need of a bit of comfort, that's where Triple Lipid comes in.
So Triple Lipid's particularly good for the postmenopausal skin that's becoming a bit dry and flaky as well, is that right?
When we go through the menopause, our production of lipids slows down, and particularly with cholesterol, ceramides and omega fatty acids. And a few years post-menopause, we typically have none of these left in the skin. So applying something like Triple Lipid that restores those lipids back to natural ratio is a big comfort blanket for the postmenopausal skin.
Yeah, because Triple Lipid's got the ceramides, the cholesterol and the fatty acids in the same proportion as you find them in the skin, same percentages, is that right?
And that's what makes it so unique and special, is it's restoring those free lipids back to natural levels, which is patented actually by Skinceuticals.
Right, okay. And the triple lipid you can layer on top of your retinol then at night, is that right?
You can do. So you would apply a very small pea-sized amount of your retinol. I like to take a dot on each area and then just blend it together. And then over the top of this, you can apply your triple lipid restore. And that will restore the barrier for you so that you don't get the dryness, the peeling, the flaking, and the irritation from the retinol.
Brilliant. That's a really, really good tip. And yeah, we certainly love the triple lipid in the clinic, and all of our patients
and
use
it's really
it.
popular for your patients, isn't it?
Yeah, it's really good amongst the people who are in that mid-50s onwards. To use as well, so that's very good advice.
And perfect for the winter too.
Yeah, absolutely.
Really
so going into the winter months, it's really good to start back on a retinol if you're already using one and you've reduced it over the summer, but you can also step up over the winter and really get into the resurfacing. So the main action of retinol is that it smooths the skin. If it's for anti-aging, then it smooths, irons out the skin, and it resurfaces the skin. So many of you will know this because we've taken you through that with your own skin. But that's been really useful to find all that out, Charlotte. Thanks very much for coming up.
Having me.
Yeah, thanks for coming all the way up and doing this with me. Thanks a lot.
Thank you. Enjoy your retinol.
Okay.